approach for counseling. So I would like to give some of the examples of counseling scenarios that you might have in Nac-osce. This could be it can come as a case of smoking cessation, someone that's been smoking that wants to stop. It might be a case of breastfeeding, someone that is pregnant and wants to know what to do when they have their baby, how to breastfeed, or someone that is breastfeeding and is having some challenges. Or it could come as a case of contraception, contraceptive or use of contraception. So maybe a young girl that has just started sexual experience and wants to prevent pregnancy, or someone that has been on contraception and want to change, or someone that's just delivered a baby and want to know the type of contraception they are going to use. Or it could be as can come as preconception counseling, could come as a case of fall or seizure disorder. So some of these are some of the examples of the scenario. So I'll try to mention a few of them, how to approach them. For smoking cessation, it's important to establish exactly what the patient is smoking. Do not make assumptions. You want to know the duration they have been smoking and how much they smoke. You want to know if they use other substances with the smoking, the route, and the how long. For example, use of ashtray alcohol smoking can prolong the number of sticks the patient is taking and inability to quit. Then in the history, you also want to know the triggers, why they smoke, what they enjoy about smoking, and how long they have considered about quitting, what has motivated them. Maybe they're already having health problems, or they're already having they have a friend that is having a health issue and now they are worried about their own health and they want to quit, and the plan they have concerning the quitting. So, like I said before, some of the risk factors you need to elicit in the history, and those are the some of the things you need to counsel the patient on using the CEPHAD approach. And in that counseling, you need to mention both the non-pharmacological and pharmacological aspects of quitting smoking. Another example is breastfeeding. Like I said, probably someone that is pregnant and wants to breastfeed, or someone that is already breastfeeding and is having challenges. So you want to know exactly why they came for that counseling. And so you need to employ the ICE approach: idea, concern, and expectation. So in taking your history for breastfeeding counseling, you want to know if why the patient is concerned, if they're concerned. You want to know if they have any breast changes, and if a patient is pregnant and is planning on breastfeeding, you want to know if they know their route of delivery, if it's a vaginal delivery or CS, because CS may influence the breast milk flow, it might be delayed. Then you want to also ask about their past medical history. You want to know if the patient has any form of infection, because some of the infections like HIV, active HIV, active TB, hepatitis, herpes on the breast might also affect breastfeeding, because these are contraindicated. You also want to know if they have any heart condition or severe hypertension. Some of these must be addressed in your um, counseling. Then you want to know if they use alcohol or smoke, because um, it's important to elicit that the history and address it. If the patient is using alcohol before pregnancy and has stopped, then you want to know if they intend to resume after delivery. You want to also remember to talk about domestic violence, their mood, their psychological support, like family and friends that will help them during the course of breastfeeding, because breastfeeding can be very hectic. So you want to also mention about their menstrual um, history, and if they plan to use contraceptive, because some of the contraceptives can delay milk let down like OCP. IUD is preferred for people that want to breastfeed, and cesarean section milk production might be delayed because of delayed engorgement. Then in breastfeeding, as you counsel the patient using the Cephad approach, remember to discuss the importance of breastfeeding, the benefits both for the mother and the child. It's all on the slide. Um, the cons of breastfeeding. So on the mother again and on the child. For the mother, there could be breast engorgement, pain, mastitis, breast abscess, cracked nipples. The mother might be exhausted. There might be sleep deprivation, and so on. For the baby might get breast candidiasis, so you want to remind the mother to always clean the breast before breastfeeding, always clean the baby's mouth um, every day to avoid oral thrush. Also educate the mother about breastfeeding jaundice and breastfeeding failure jaundice. Also mention that breastfeeding should be given on demand, and children that are breastfed should be given vitamin D, um, and those that are given cow milk should be given iron supplements, and premature babies should be given iron supplements. So there are some contraindications to breastfeeding, like I mentioned before, things like infections, um, chemotherapy, and some drugs like lithium, bromocriptine, chloramphenicol tetracycline, alcohol that are more than 5 grams per day, that are all contraindication. And if a baby is diagnosed of lactose intolerance or galactosemia or milk protein allergy, they are all contraindicated and should not receive breast milk. Another example is contraception counseling. So in contraception counseling, you be sure to take a focus history again. You want to know if the patient has used contraceptive before, the type they have used, why they stopped, if they had any side effects. You want to know if they have any risk factors that could influence their choice of contraception. For example, patients that have had STD or PID, or um, people that have multiple sexual partners should not use IUD. And there are some contraindications to hormonal contraception, such as active liver disease, breast cancer that is active, unexplained vaginal bleeding, thromboembolic event like DVT, stroke, migraine with neurological symptoms. They should not have hormonal contraception. So in contraception history taking before counseling, sexual history is important, menstrual history, gynae and obstetric is important. All these things, when you elicit them, you'll be able to help the patient to make a choice of contraception, um, in cooperation and collaboration with the patient's choice based on your counseling. You'll be able to satisfy this patient in this counseling section. For fall, the most important thing in fall is to empathize with this patient. Always remember to ask them if they had any injuries, if they had any body movement when they fell, and also you want to explore the cause of this fall, because you want to talk about fall prevention. So to achieve this, it's important to talk about the pre-event, what happened to them before they fell, how they felt. Probably the patient was dizzy or excessive sweating, pointing you to hypoglycemia, or heart racing, pointing you to arrhythmias, speech difficulties, limb weakness, blackout, and so on, pointing you to stroke or something like that. Or it's just a mechanical factor. Maybe there is litters on the floor, water on the floor, poor lighting, lack of grabbing bars or skate shoes, that caused it. Lack of all of those things, you need to address them. It has to be patient specific based on the fall, based on the cause of the fall. It's important to also look at red flags, such as if they lost consciousness, they turned blue, or their body was moving like convulsion type. So you'll be able to address some of these things. So risk factors again, um, things like arthritis and gait problems should be mentioned. We want to also ask the patient about past medical history. Like I said before, diabetes, stroke, hypertension, they are all important. If you really see these things in the history, you need to explore and be able to address them in your counseling. And again, it's important to talk about support at home. Who is helping them? Who is doing their daily activities, groceries, and stuff like that. So remember this safer approach and go step by step, and you'll be able to get your counseling done. Always remember to pause and ask the patient if they understand what you're saying, if they have any questions, and be able to answer. In every case of counseling, always check back to know that your patient is following. And finally, counseling session could be um, a seizure disorder counseling session. In seizure disorder, it's important to empathize again and ask the patient if they had injuries, if they lost consciousness, just to know the type of seizure they have so that you'll be able to counsel properly. If they had any auras or headache or fever, probably you want to know what is actually causing the seizure if it's a first time seizure. If it's someone that have been having seizures before, you want to know what triggered this episode. Probably so you want to ask about the some of the risk factors, like if they've been taking their drugs regularly, if they've been having alcohol use like padding, or they've not been sleeping well. Sleep deprivation is a huge one. And then excessive stress is also very important to elicit so that you can cancel right. And if these are the reasons, you need to talk about them in your counseling. Let the patient know why they're having it, what has caused it, and then use the suffered approach again to make sure your patient is following what you're saying and is on one page with you. Most important thing in counseling for seizure is to remind the patient, tell the patient that you need to report to the Ministry of Transportation and the driver's license might be withheld. Patient at this time might be upset. You need to calm the patient down, reassure them, and make them know it's just all about safety for their own safety and others. Then also for people that have seizure disorders, it's important to mention to them that activities like swimming, operating machines must be closely monitored.